Do you know what's a wonderful feeling? Is when a patient comes to me, they ask for aligners to straighten their teeth, and then we take a scan, we submit it to the company. The designer sends it back and it's perfect. I go ahead and approve the case, they print the aligners, I deliver them to the patient. Patient's excited. They come back in and their teeth are beautifully straight, no problems, no issues. The biggest issue is that I don't think I've ever felt that excitement because it never happens. That leads me to one of the biggest misconceptions right now in the clear aligner space is that it's easy. The aligner companies, the internet, everyone wants everyone to think that all we have to do is have a patient come in, scan them, send it to the company, the technician, AI, the magic person behind the company sets everything up perfectly so that as the provider, all we have to do is then deliver the trays, the patients are going to wear them, all the teeth are going to track, and we're going to have wonderful, happy patients with 5-star reviews. The truth of it can't be further from that. It takes a lot of planning, hard work, and to be honest, a lot of learning in order to get that to work. So whether it's a provider trying to market their practice, saying how easy it is, whether it's a company trying to market their new aligner on how it requires less attachments or they have less refinements, all of this is marketing. But at the end of the day, marketing doesn't treat patients. We do. So we have to look at three things. We have to look at the diagnosis first, then we have to look at the plan, and then the execution. All three of these are wildly important. When we look at planning, we have to make sure that we look at the patient from different lens. What is it that we're trying to achieve? How predictable are we going to get there? And can aligners do everything that we want? Or do we have to use some cosmetic dentistry on top of it? When it comes to the plan, is the plan going to get us from point A to point B predictably? And predictable movements are very important because without it, we get unhappy patients. And the last thing is execution. Execution is one of the most critical things that we, I think, falter on when we do clear aligners. And we can plan beautifully. We can have a great problem list. We can spend hours setting up a digital treatment plan. But then when we go to deliver those trays, we fumble. And when we fumble on any one of those three spots, we end up with very unhappy patients. Now, if this patient has been a long-time patient in your practice, sometimes that can lead to a pretty unfortunate exodus of patients. Sometimes it's a simple solution, but other times it's not. So it's very important to realize that clear aligners are wonderful. They're great at moving teeth. We can make beautiful, happy patients. We can make their smiles awesome, but it's not easy. It becomes easier the more you know, and that's why it's very important to really dive into the education side. Do not rely on the companies to feed you a plan because what you're going to find is that it's not going to work. So I would say that that's probably the biggest misconception right now is that scan, send it to the aligner company, and then everything works out beautifully. Like I said, aligners are awesome, but that is definitely not the reality in which we live in.